Welcome to the Holistic Psychiatry Podcast. I'm Courtney Brown Snyder, a physician and holistic adult and child psychiatrist. In this episode, I'll be discussing the relationship between skin conditions and brain-related conditions. This information is for educational purposes and not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment for yourself or others, including but not limited to patients that you are treating if you're a practitioner. Please consult your own physician for any medical issues you may be having. Skin issues are common in those with brain-related conditions. Most of what we'll find, however, on this relationship is the suggestion that one is causing the other. It is believed, for example, that the stress of having a skin condition can cause depression and anxiety, which makes good sense, or that the stress of a mental health condition is causing an increase in stress hormones or inflammation that then leads to skin symptoms. This also makes good sense. In this newsletter, I'll argue that skin and brain symptoms have shared common roots, and one in particular. I'll address the many ways zinc impacts the skin. I've recently talked about the many impacts of zinc on the brain. I'll address skin symptoms associated with specific root causes of brain symptoms, including low zinc and high pyrroles, high copper, mast cell activation, candida, mold, methylation imbalances, electromagnetic hypersensitivity, and Bartonella. I'll also address how traits such as flushing, early graying, or a pale complexion can suggest vulnerabilities to brain symptoms. Obviously, not everyone with these traits has brain symptoms, but for those who do, these traits can point to a likely underlying contributing factor. I'll address how certain acne treatments can worsen mental health conditions, and I'll address the importance of understanding these shared root causes, which I hope becomes evident through this episode. To start, the zinc link. The Walsh Research Institute found zinc relatively low in about 90% of those with brain symptoms. Again, I've recently shared the many impacts of zinc on the brain, which I'll link to. But how does zinc impact the skin? Zinc is involved in promoting the growth of new skin cells, wound healing and scar formation, reducing inflammation, stabilizing mast cells and regulating the production of inflammatory mediators, modulating the antioxidant response, making collagen, which is the main protein in our skin, regulating keratin production, which is the main protein in our hair and nails, regulating oil production, so too much oil could contribute to acne, and too little could cause dry skin. Producing melanin, which gives our skin and hair its color. Maintaining hair growth through its role at the hair follicle. As you can see, zinc can be a factor in poor wound healing, poor elasticity, stretch marks, and even wrinkles. It can be a factor in a range of inflammatory conditions, including itching, rashes, hives, psoriasis, acne. It can be a factor in fungal infections of the skin or loss of skin color. Vitiligo is a skin condition that results from loss of melanocytes and defective melanin synthesis. It is considered autoimmune. And guess what? Zinc deficiency can play a role in autoimmunity as well. Zinc can play a role in the loss of hair color, as in the case of premature graying, the severity of alopecia areata, which is spot baldness, and brittle nails and hair. Even something as common as dandruff may be related to zinc. There was a study that showed adults with seborrheic dermatitis, which is dandruff, were found to have lower zinc levels. The major culprit of dandruff is a fungus, which exists on the scalps of most adults. In infants, it is called cradle cap. In recent years, zinc supplementation has been used for various skin conditions. The field of dermatology appears to be ahead of psychiatry and the rest of medicine when it comes to the appreciation of zinc. Common root causes of brain symptoms and associated skin symptoms and traits. As a holistic psychiatrist, I pay attention to skin symptoms and actually all physical symptoms because they can help point to the underlying root causes of brain symptoms. Normally, when it comes to brain symptoms, multiple root causes are aligning. Here are some of the more common ones and their associated skin symptoms. So low zinc and high pyrroles. So high pyrroles, which I've talked again recently in an episode about, can cause low zinc as well as low B6 and magnesium. Stress of any kind can cause an increase in pyrroles and thus a decrease in zinc. So associated skin symptoms include a pale complexion and burning easily, acne, stretch marks, dry skin, psoriasis, poor wound healing, white spots on fingernails, and early graying of hair. High copper is also associated with low zinc, and with high copper, we might also specifically see a skin sensitivity to metals. Mast cell activation is an exaggerated immune response. Again, I have an episode and newsletter on this topic as well. And this can cause secondary brain inflammation. Symptoms related to the skin can include hives, facial flushing, dermatographism, and this is where you can write on your skin with your fingernail and it will leave a red raised line. There can also be exaggerated reactions to bug bites or feelings as if the skin is on fire. Mold and candida can also cause brain symptoms as well as skin symptoms. Low zinc can impact our vulnerability to infections and colonizations, including candida and mold. So we might see fungal infections of the skin or nails, facial flushing, itchy ear canals, which is associated with candida, acne, and any skin symptoms associated with mast cell activation, as mold toxicity is one of the most common causes of mast cell activation. With EMF sensitivity, we might see burning sensations of the skin, often of the face, hands, or lower arms, seemingly due to a mast cell-mediated response involving areas of closest proximity to computer screens or when someone's holding a cell phone or even their mouse. There also can be tingling sensations. With undermethylation, we may see sparse body hair. With overmethylation in men, we may see more body hair. And with women, we may see hair loss on the head. With Bartonella, we may see purple or red stretch marks. Acne medication. It is not uncommon for me to see patients who have been on long-term antibiotics for acne. Did low zinc cause their original skin and later brain symptoms? And/or did the long-term antibiotics disrupt their microbiome and cause candida overgrowth with its toxins and inflammation and worsening brain symptoms? Similarly, I've seen several adults and teens who were once on Accutane. The generic isotretinoin is sold now under different names. It has been linked to worsening depression, anxiety, and psychosis. Some studies have shown an increased risk of suicide attempts and suicide, and still other studies have shown an exacerbation of bipolar symptoms while taking this medication. I'm not a dermatologist, but I share this information hoping to help someone with brain and skin symptoms find their answers more easily. I also hope this information points someone to effective alternatives for their skin condition so that they may be able to avoid treatments that could worsen or precipitate brain symptoms. Lastly, I hope to point out that we are whole beings with amazingly interconnected systems. Our brain is not separate from our skin or any other part of our body. Thank you for listening. If you'd like to receive these newsletters and episodes in your mailbox each week, please consider subscribing at CourtneySnyderMD.com, where I also have information on my consultations that I offer nationally and internationally. Until next time, take care. Bye-bye.